there, this is Ginger Bandine, Director of Clinical Data and Analytics for Pinnacle Health Informatics, and today we're going to be talking about a report designed to help with tracking trends in services at behavioral health agencies in the aftermath of the COVID-19 pandemic. So we're doing this presentation for our user group today, but this is something we will share on our YouTube channel as well. So first I wanted to talk a little bit about the origin of this project. We were having some conversations with our partners about all of the changes that were happening in the midst of the pandemic and how that was impacting behavioral health. And in particular, we were talking to one agency who said they just couldn't tell what was going on anymore, that it was really hard to manage things remotely. All the staff had moved to remote work, and it was really hard to keep track of how things were going, whether services were still being provided, whether clients were falling through the cracks, whether workflows were being followed and whether things were working and all of that. So we started brainstorming about what data was important for tracking those trends. And then also started talking about how to organize that data so that you could get an agency level view of how things were going. And then also at the program or team or provider level, also see if there were any specific trends that could be addressed. So we ended up settling on some areas that we wanted to look at. So we knew we wanted the big picture. We knew we wanted to look at a section around, or some sections around, process changes. We wanted to look at volume and demand, and then we wanted some tools for looking ahead to see any patterns that were coming out in the future weeks. So that's the sections we decided to bring into our report. So this is the big picture. This is the full report that shows all these different sections. And as you can see at the top, there's an area called total, which I don't have a picture of this, but you can select in this report the programs you're interested in looking at and the providers you're interested in looking at, or you could select everyone, all the programs and all the providers, in which case this total would be the total for the whole agency. Or if you had just selected a subset of programs and providers, this would be the total for the folks you had selected. And then there's also a total or subtotal for each program. And then you can see grayed out here are the individual names of providers and their data going across. This report is also designed so that you could switch how you had things grouped. So you could have it grouped first by provider and then by program so that you could see the provider total across programs. Or you could have it this way, the way we're showing it here, where it's by program and then provider. So this first section of the report is really looking at process changes. So a lot of the services at this agency have moved to telehealth. So we wanted to look at attendance. We wanted to look at whether services were being recorded from a pre-scheduled appointment. And we also wanted to look at documentation and whether it was being completed within the timeframes at this agency. So at this agency, documentation needs to be completed within 24 hours of a service. But what's kind of cool about this report is that each of these columns include the data for the current time period that you've selected, and then it goes back and looks exactly 1 year ago, what was your data then? So the slightly lighter colored areas of the graphs here are the previous year, the same data for the same period of time 1 year ago. So as you can see here, like services getting recorded from an appointment, the blue indicates it was recorded from an appointment and the pink means it wasn't. You can see that the proportion of services being recorded from an appointment has gone up, and also the total number of appointments has gone up. And also with documentation completed within 1 day, that's the proportion has gotten better, and also the total has gotten better. So we're trying to show multiple pieces of data in one report. And also we really wanted to show exactly 1 year ago because so often the data in a behavioral health agency fluctuates throughout the year. So comparing data from, let's say, March to your data from January is really not a very accurate way of looking at that information. And then the next section of the report looks at volume, but we wanted to look at volume of services through several different lenses. So we wanted to look at the count of services. That gives you one picture of how things are going. But another important thing to think about is how many unique clients are being served, because you might be doing a lot of services, but perhaps not for as many clients. And maybe if some folks are having a harder time getting access to services through telehealth. And then the provider hours of service, which means the straight hours of service being provided by a provider, is different from the client hours of service if a lot of group services are being provided, because for one provider hour of a group service, you might have many client hours of service. So that's why we have all of these broken out differently, and it does let you see some interesting trends. So for example, here in the total area, you can see the total count of services has gone up for this agency, or for this subset of data selected in the report for this agency. The count of clients served has also gone up, the provider hours have gone up, and the client hours have gone down slightly, which makes sense because probably they had a little bit of, for most agencies, setting up group appointments took the longest for telehealth, so it makes sense that for every provider hour of service, they may not have been getting as many client hours of service. And that information is still important because it means that if there's fewer hours of client service, there may be less revenue being generated but that doesn't mean necessarily that the providers are working less hours. It's just that there aren't as many group services being provided. So that's just some important information to keep in mind. If you're looking at service trends, I really recommend looking at all of these areas: the count of services, count of unique clients, provider hours of service, and client hours of service. And then this section of the report is really focused on looking ahead. So what we're doing here is looking, whatever date range you've selected for your report, the report looks 7 days into the future based on that date range, and then shows you how many appointments are scheduled in those next 7 days for whatever people you've selected. And for the same week last year, or the same 7 days last year, how many appointments were scheduled. And then we did the same thing where we're looking at unique clients scheduled versus unique clients the previous year. Then this section here is kind of a special thing that we wanted to do to look at whether folks were falling through the cracks. So what this section does is it looks at a provider's caseload and identifies folks on their caseload who have not received a service in the previous 45 days. So the green sections here are the individuals on the caseload on a person's caseload who have had a service in the past 45 days. The orange section are folks who did not. And then it does the same thing for the exact same time period last year, so that you can see if there are trends. So like, for example, a trend that would be perhaps worrying would be if more people were on a person's caseload who had not been seen in 45 days. That might mean that there was some additional outreach and engagement that was needed. And then finally here at the end, we've got unique clients by payer. This was in particularly important. Well, I think this is possibly important across agencies, but in particular for this agency, because they were also having some shifts in the payer mix. They knew certain payers were doing a fee-for-service payment schedule, and so they really wanted to know, out of the clients we're seeing, what's the mix of payers for those individuals. But I could see that being valuable also for agencies anywhere, because I think we're going to start seeing some trends as this pandemic and the economic impact of the pandemic plays out across our country. We may see fewer people who have private insurance and more folks who have public insurance. We may see more folks coming in who don't have insurance. So I think looking at the payer mix compared to the payer mix last year at the same time can be really valuable. So that's our report. In our user group discussion, we also had folks mention some other ideas, like comparing revenue would be another thing. A question came up about why we didn't include revenue on this report, and that's because traditionally, and at some of our behavioral health agencies, revenue posting happens with a bit of a delay, and so we really wanted to provide some real-time information that could help people see what's going on right now and what's changed and what's happening. But looking longer term, you could include revenue information there too. The other question was around perhaps adding in some data in there that separated services out by whether services were being provided by telehealth or telephone, or kind of a hybrid. Well, a model that some agencies are using is if an individual can't connect to telehealth from their home, that person might go into the agency, to the office to receive services, but they're still receiving it through telehealth. So the provider's not at the office, but the individual receiving services is at the office. And so there was some discussion about the tracking those different modalities might be helpful in terms of identifying which ones are most successful and most, how to balance out the folks that perhaps bringing more providers back to the office would be valuable, or how to figure all of that out. So those were the things we talked about. That's our report. If you have any questions or you'd like more information, please reach out to us at info@phidw.com, or you can reach us by phone at 971-409-6931. Again, this is Ginger Bandine, and it was nice talking with you today. Have a great day.